My name is Erica Mesa, and I'm currently in the Adult Gerontology Acute Care Nurse Practitioner program at UTIP. I'm currently taking Adult and Geriatric Health and will be presenting an H&P on a 57-year-old male. This is a 57-year-old Hispanic male with past medical history of GERD and hypertension, who presents to the ER with a chief complaint of seizures. Patient states that approximately at 7 in the morning, he experienced a seizure that lasted 10 minutes. His wife reports that patient was shaking, especially in his arms and legs. He denies biting of tongue, vision loss, dizziness, nausea, vomiting, loss of bladder control, loss of bowel control, or drooling during or after seizure. He also reports having abdominal pain that started this morning. He describes his abdominal pain as constant, non-radiating, alleviated by pain medicine, and aggravated by movement. Past medical history includes hypertension and gastritis. Surgical history, none. Family history includes his mom, liver failure disease, father, no medical conditions, living. Allergies, none. Medications include lisinopril 10 milligrams PO daily and Zantac 1 tablet PO daily. Social history. He is married, currently not working. He is a current smoker. States he smokes 3 cigarettes a day and he's been smoking for the past 40 years. He also admits to alcohol use. He states he drinks 5 32-ounce beers daily for the past 5 years. Immunizations, none. The review of system is as follows. General. He reports weakness and fatigue. Head. He denies any dizziness or syncope. Eyes. Denies vision changes. Ears. Denies hearing changes. Nose. Denies nosebleeds, sinus pain, or discharge. Throat. No masses on neck. Respiratory. He denies chest pain, shortness of breath, coughing up blood, or recent lung infections. Cardiovascular. He denies chest pain with exertion or at rest, orthopnea, dyspnea, murmurs, or palpitations. Gastroenterology. Reports mid-abdominal pain, does not radiate, denies nausea, vomiting, dysphagia, heartburn, or constipation and diarrhea. GU. Reports urinary frequency, but denies heterogeneity, dysuria, and icturia. Musculoskeletal. Denies arthralgias, arthritis, joint swelling, or back pain. Hematological. Denies anemia, bleeding, or bruising. Endocrine. He denies polyuria, polydipsia, and polyphagia. Physical examination. General. Patient is awake, alert, oriented, laying in bed comfortably, but his wife is providing most of the information. He appears well-groomed and no apparent distress. Vital signs include blood pressure of 126/72, pulse of 77, respirations 18, temperature of 98.8, current weight is 54 kilograms, height is 160 centimeters. Skin. Skin is tan in color, there's no redness, no rashes, no cyanosis, no edema. HEENT. Head is normocephalic, eyes are perla, facial sensation is intact, face is symmetric, tongue is symmetric, gag reflex present, no abnormal findings. Neck symmetric, no tracheal deviation. Respiratory. Chest expansion is bilaterally symmetrical, no unlabored breathing, auscultated clear lungs on all lobes, no crackles, no wheezing, no physical abnormalities present on chest. Cardiovascular. S1 and S2 present, regular rate and rhythm, no murmurs, no rubs, no gallops. Pulses +3 in all extremities. Abdomen. Soft, non-distended, tender to palpation, bowel sounds present in all quadrants. Musculoskeletal. No muscle atrophy or deformity, full range of motion to shoulders, elbows, wrists, hips, knees, and ankles. Neurological, awake, alert, oriented ×3. Labs include a sodium of 126, potassium of 4.4, chloride of 90, BUN of 9, creatinine of 0.74, glucose of 160, white count of 8, hemoglobin of 16.5, hematocrit of 47.7. Radiology studies include a CT of the head, negative, and an X-ray negative for abnormalities. Assessment includes the new onset of seizures, fever, sepsis suspected, urinary tract infection, dehydration secondary to alcohol abuse, hypernatremia, alcohol withdrawal, delirium tremens, and thrombocytopenia. The plan will include to monitor procedures, place on seizure precautions, and start on IV Ativan PRN. We'll also start IV fluids at NS at 100 cc's an hour for hyponatremia and hydration. We'll continue IV antibiotic Rocephin 1 gram IV Q12 for urine infection. We will also consult infectious disease for urinary tract and possible sepsis. For treatment of alcohol withdrawal and delirium tremens, we will start on Keppra 500 BID IV and Librium PO. Also start a banana bag infusion at 40 cc an hour. We'll continue to model alcohol withdrawals. Treat abdominal pain with Tylenol 500 milligrams PRN. Repeat UA in 48 hours. DVT prophylaxis with STDs only. Gastrointestinal prophylaxis with Protonix 40 milligrams PO daily. Continue home medications, lisinopril 10 milligrams PO for history of hypertension. Repeat CBC, CMP, PT, PTT, and INR in the morning. Thank you.